Good afternoon and welcome to H360 Live. My name is Courtland Long and I'm joined here in the studio today by my friend and colleague from H360, Dave Duplay. How are you, Dave?
Courtland, I'm doing great. We had a great weekend. We were at a couple of walks both Saturday and Sunday, so that was good.
Yeah.
You know, we're right in the middle of our walk season, and it's great to get out and see all these folks getting out, raising money for good causes, and getting a little exercise in the process.
Yeah, these walks that we go to, they're really one of my favorite things that we do here at H360 because we've built such an amazing community of people who are touched by some chronic condition or another. And it's at these walks that we get to go out and really see the people in the community and talk to them and see how H360 is helping them live better lives.
Yeah, you know, as our friend Dr. Weber would say, we get to mix and mingle, and I like that.
Absolutely. Yep. Well, we have a really exciting show for everyone today. We have Dr. Erica Jones here. She is a cardiologist at Weill Cornell, and we're very excited to talk to her all about the Heart Health Program and the Dalio Institute.
You know, I'm really excited for this show because I think that medical imaging and the heart, it's fascinating, right? And as I understand it, and I'm not a doctor, I'm almost a doctor, but not quite, with the heart, it's such a fascinating organ because there could be, you know, you've got electrical issues, you've got plumbing issues that could go wrong. So, and I find it really fascinating. And I think that technology has really changed the game in heart health, and we're going to talk to Dr. Jones about that shortly.
Yes, it's going to be very exciting, but first, as always, we have some health tips to cover, and these tips are very focused around today's show. They're how to maintain a healthy heart and even prevent heart disease. So we'll kick it off. Tip number 1 is simply exercise. This is essential for maintaining optimal heart health. Be sure to talk with your doctor before engaging in any sort of physical activity. Make sure it is safe for you and your lifestyle. But simply walking more every day is really going to be a really good step forward to maintaining a healthy heart. You want to try to get about 20 to 30 minutes of exercise every day, and this will help to reduce blood pressure, lower cholesterol, burn body fat, relieve depression, and also increase your self-esteem.
You know, Courtland, you make a couple of points that are really spot on. One is, and we always say this, talk to your doctor about your health before starting an exercise program. I think that's really critical. You have to have a baseline. You don't want to jump into P90X if you haven't exercised for years and years. You got to really ease yourself into it. Talk to your doctor about that. So I'm spot on with that one. And you know, as we age, Courtland, we get a little heavier, and exercise is so important. You got to really maintain that weight for proper heart health. So I like your first health tip. I've got one for you, and that's eat a little healthier. You know, especially here in New York, we are so busy. And it's, you know, sometimes eating is, there's so many street, things on the corner, pizzerias and different places, and sometimes it's very convenient to just swing in there. But you really have to focus on a proper diet. And, you know, all food groups, you got to take that into consideration. But there are a few things that I'm sure Dr. Jones will talk to us about, and that is sodium intake. You really have to limit the sodium. You know, there are so many spices out there that really add flavor to your food, so there's no reason to, first grab for that salt shaker. That's a no-no. You want to really watch that salt. Eat healthy, a lot of fruits and vegetables. You want to stay away, I think, from a lot of processed food. So really take a look at your diet, and again, talk to your physician or talk to a nutritionist, and they can put you on a plan that's going to be appropriate for you. So I really like that. So exercise, Courtland, you point out, and in New York, we do a lot of walking, so we get quite a bit of exercise, which is good, and eating healthy. I think you have one more tip.
I sure do, but I really like that in your tip you bring up lowering the salt and increasing the herbs and spices to make foods a little more interesting. Last week we had on the show Susan Bratton of Savor Health, and she has this amazing cookbook, Meals to Heal, and in that cookbook there are tons of delicious recipes that have a lot of herbs and spices to make food really delicious and healing if you're going through the cancer journey.
Yeah, absolutely. Great book. You can find it on Amazon.com, by the way.
Yes, you can.
Yep.
Well, tip number 3 is to know, monitor, and control your risks. Now, these include monitoring your blood pressure, weight, and cholesterol levels. Checking these regularly is going to help empower you to be your own health advocate and ask informed questions when you go to visit your doctor.
You know, you make another great point, Courtland. You have to be your own health advocate, right? You have to take control of your health care, understand the risk factors, right? An ounce of prevention, right, I think is what we say.
Yes.
And so you really have to focus on that one. So 3 great health tips: know your risk, eat healthy, exercise, and one, Courtland, I'm going to give you a free one today.
Oh, okay.
All right? Here's one I want to share with the audience. Put the cigarettes down.
Yes.
Tobacco use is, in so many ways, really bad for you. Not only bad for your lungs, first-hand smoke, second-hand smoke, and now even third-hand smoke, right, is very, very bad. And every cigarette, I believe, puts another nail in your coffin. So you really have to, if there's any way possible of ridding yourself of tobacco use, I think that's going to help you out as well. So not on the script today, but I'm going to throw that one in there for good measure.
Well, it's not only going to help you out, it'll also help out your friends and your family, especially with the third-hand smoke that you bring up. If there are small children in your household or babies, third-hand smoke, which is the carcinogens remaining in your clothes and your hair, and even the upholstery in your house, is really dangerous.
Yeah, absolutely. And it might even help your relationships because, after all, nobody likes to kiss an ashtray, right?
Yeah.
That's what I say.
Right.
Anyhow, 4 great health tips, Courtland. Way to go. All right.
Well, now, as always, it's a really fun time of the show where we're going to watch the In the Field video where our interns go out to Bryant Park to ask our friendly New Yorkers about their opinions on some of our health tips. You want to watch this video?
I would love to watch it with you. Can we have popcorn?
Well, it's not on our whole 30.
Oh, that's right. We'll skip the popcorn and watch the video. Take a look at this.
Do you exercise?
Yes, yeah, I do.
Yes, I exercise. Yes, I do.
I do. You do? So why do you exercise?
I exercise for my health, to stay in physical shape. Been on a diet recently, so that's why I exercise more often.
I like keeping fit, and it's just a way of life.
I exercise to feel good, and I don't know, it's a social aspect. All my cousins exercise too, so we'll exercise together.
Okay, so how often do you exercise?
Probably every day.
6 out of 7 days a week, I'd say.
I exercise 4 times a week to stay in shape.
Probably, I make it a goal to exercise a little bit every day, whether that's like walking, 15 minutes, but I do yoga like twice a week.
What do you consider healthy eating?
Oh gosh, organic, whatever that means, lots of vegetables, lots of green.
For healthy eating in my diet, I try to just buy a lot of fruit and vegetables, and I like to cook.
I consider healthy eating no fast foods, lots of fruit and vegetables.
I think balanced diet, not too much fats.
How would you maintain a healthy heart?
Definitely exercise. And it's what you put into your body, so not a lot of fatty food, not a lot of stuff that can clog your arteries, low cholesterol foods, not very oily food.
That's a good question. I'm assuming exercise and good eating.
Everybody has a different level of exercise and a different diet that pertains to them. However, I think at the very least, if it's a nice day, instead of staying inside, go outside and garden, or go outside and, go for a walk around the lake.
Low stress, and I'm somebody who deals with anxiety and stress on a daily basis, so as we all do. So I'd say finding ways to cope with anxiety and things that put stress on the heart is a good way to make sure that you stay healthy.
Well, Courtland, what'd you think?
I thought that was an excellent video. Of course, our New Yorkers never disappoint. They had some really excellent opinions about exercise.
Yeah, as I said earlier, in New York we walk a lot, and so that's evident, right?
Yeah.
I think people are getting a lot of exercise, and I think people, for the most part, are really cautious about their diet, and they're really focused on trying to do the best they can with their busy lifestyles here in the city of eating properly.
They really are, and in the beginning of the show you brought up that there's so many convenient things and fast things to get here in New York. And we talk a lot about those fruit vendors that are on many of the corners throughout the spring, summer, and fall. So, those are also really fast and convenient ways to get some healthy foods into your diet.
You know, I am a big fan of that.
I
Yeah,
know.
I talk about this all the time. My little guy in my neighborhood
Yeah.
with his little fruit stand, and it's the best in the summer when you see the truck with the Jersey plates coming in, and they've got these Jersey tomatoes, which I can just eat them like an apple, and the Jersey corn. Oh, there's nothing better than that with a little squash and zucchini. You know, that's really eating healthy.
It certainly is. Sounds like you're going to have a great summer.
I am going to have a great summer, and I very much limit the salt. I'm all about the spices and herbs on the steamed vegetables, so, you know, I really like that.
Yeah, good. Well, now, Dave, it's our favorite time of the show where we have Dr. Jones coming into the studio. And I think you have some background on her to tell our audience.
I do. I'm going to talk a little bit before we engage with our conversation with Dr. Erica about some things about heart health that I think are really important for everyone to understand, because some of these data points are really eye-opening. So here we go. The first one is, did you know that more than half of the patients who have heart attacks or a stroke have no symptoms at all before they have that event? So we talked about prevention. I think that's where that comes in. Most people who have had a heart attack actually have normal cholesterol, so you need to really think about that. And there are many other risk factors, as we're going to talk to Dr. Eric about, that need to be addressed. Stress tests are not helpful in determining the risk of cardiovascular disease in someone who has no symptoms at all. And 80% of cardiovascular risk reduction can be achieved with lifestyle changes alone. Okay, Dr. Erica, that 80% can be changed with lifestyle changes alone. Why aren't we all out there changing our lifestyle? It's just amazing. I'm so glad to see you here. We have so many questions. I'm going to turn it over to my colleague to get us started.
Thank you.
Yes, well, Dr. Jones, again, thank you so much for joining us today. We actually have a private support group of women with AFib, so I know that this is going to be especially applicable to them. But first, can we start out with talking a little bit about the history and mission of the Heart Health Program and some of the services that are provided there?
Well, thank you very much. Thanks for having me here. So Heart Health is the cardiovascular prevention program of the Dalio Institute of Cardiovascular Imaging at New York Presbyterian Hospital, which you might say, well, why is it imaging? And so a little background on me is that I am a fully trained cardiologist, not a radiologist. I've been at Cornell for over 20 years, and I ran an inpatient unit before, so I had a look at the other side of heart disease and trying to deal with, you know, the consequences of heart disease. And then in July of 2014, I was asked by my colleague, Dr. James Min, who's the director of the Dalio Institute, to come over and run the clinical side of his research and imaging. And it works perfectly, actually, because of really what you said, is that most people who are at risk for heart disease don't actually even know. And so our mission is to seek out those people and seek out their physicians and find those people who are at risk, and then figure out what their risk is, often with imaging, and we'll talk about that, and then holistically, to the best of our ability, change that risk. 80% of it can sometimes be changed, but in that large minority of patients who really do everything that they can and are still at risk. I tell some of my patients, you know, you could eat this table and still have bad cholesterol if you're producing it or if you have a genetic predisposition. And so some of those patients do require medication, and we work with that also.
Yeah. So going through medical school, what really drove you to cardiology?
You know, it's so interesting you should ask that. You always go towards what your interest. You know, when I would read, I found like, well, that's kind of neat and that's really interesting. And like you said, it's a little bit of plumbing and it's a little bit of electrical. And the plumbing side of it especially, if you think about it, it makes sense. Look, there's a lot of memorization in medicine and we have to memorize, but in general, if you think about the physiology of the heart, it makes sense. Flow has to go forward, and if it doesn't go forward, it goes backwards. And if it gets clogged up, it can't go forwards. And so a lot of it made a lot of sense. And then the other thing that I really like about cardiology is that you can make such a huge difference, and you can fix things. You can really fix, you can cure a lot of things, and that's just very satisfying.
Yeah.
So the Heart Health Program offers assessments to determine one's risk of cardiovascular disease. What are some of the most important factors, and how do you measure those exactly?
Well, you know, a lot of people know the classic risk factors. So I hate to say it, but men are at a little bit higher risk, a little bit earlier than women. High blood pressure or hypertension, high cholesterol, smoking, obesity, and interestingly, obesity is more because of the company it keeps, and that specifically is type 2 diabetes. And so the obesity epidemic really, and the high sugar content in our diet and the diabetes. So those are sort of the classic, along with inactivity. But now there's also these what I call novel or newer risk factors that we're starting to focus on. So for example, women who had high-risk pregnancies. A lot of women don't realize that preeclampsia, hypertension, gestational diabetes puts them at significantly increased risk of heart disease later in life. And as most of us who have children know, you have your children, you get to child rearing, you go back to work, you do everything you can, and you really don't think about your health for many, many years. So that's a big risk factor. Inflammatory disorders. There is a lot of data out there to suggest that cardiovascular disease is probably inflammatory or autoimmune. It's us fighting our environment. And so, again, a little more common in women, but things like lupus and rheumatoid arthritis and inflammatory disorders, inflammatory bowel disease. These patients have a higher risk of heart disease, HIV disease. So there's a lot of things out there that some people aren't even thinking about, and so I'm reaching out to those physicians to bring them in. And then one thing that I think people are aware of, but I'm really focusing on, is a family history of premature cardiovascular disease. So if your dad had a heart attack in his 40s or 50s, or your mother had a heart attack or a stroke in her 50s or 60s, that puts you at significantly increased risk. You have their genes. And as they say, well, 60 is the new 40. Well, people are living longer and longer, and so when someone says, oh, my dad had a heart attack at 70, he was pretty old. I don't actually think of that as pretty old anymore, and so I'm really focusing on those people, and that's who comes to me. I tend to get the crowd that self-refer when they've had a family history of early disease or a friend who's died early, and it makes them think about it.
Yeah, you're so right. I'd add another category in there, and that's and we talk about this all the time at Healthy 360. And that's the category of caregivers are sometimes at high risk. You and I were kind of in this sandwich generation, right, where we've got children, and we're worried about them and getting them off and helping them get their career going. And then we have aging parents. And so I see a lot of this that, these caregivers, we always say as a caregiver, if you don't take care of yourself, you can't take care of someone else. And I see it in my own father. He's caring for my mother, who's an Alzheimer's patient, and his days of playing golf 5 days a week are gone because he's caring for my mother. So you really have to watch, and I think that's a risk factor as well.
Oh, absolutely. My mother slipped and fell on the ice 2 days ago, broke her nose in 4 places. So now she's dealing with doctor's appointments. It's on that end. But the airline industry actually does have it right. Put the oxygen on yourself first, and then take care of the others around you. You have to take care of yourself first, and then. But you're right. When you're sandwiched between the job and the children, and that brings up one other thing that I did not bring up, is depression. Depression and anxiety actually is a much higher risk. People who are depressed not only have a higher risk of cardiovascular disease, but they have worse outcomes than when they have an event.
Yeah. We've got to get these risk factors known. We've got to do a better job at getting that message out there. And that's what we're trying to do here with you, of course, is to get that message out there and talk about these risk factors and get them, let's bring the conversation from the back room to the front room and talk about it, because that's how we're going to solve the issue, I think.
I agree.
Well, you have these patients who come and they self-refer to you. So what is the typical treatment like? What do they experience when they're in the heart health program?
Oh, okay. So first and foremost, I sit down and I talk to them. They actually have them fill out some forms before they come in, so I have a little idea of what's going on, and a lot of that asks about family history, asks about pregnancy in women, asks about premature deliveries, some things, so we have somewhere to start. And then I talk to them about their concerns and what their understanding of their risk is. If they know their numbers, some of them will bring either CAT scans they've had done or blood work they've had done. Others will come in completely naive and have nothing done. And so we talk for a good 20, 30 minutes, Then I examine them. We get blood pressure, heart rate. You know, we go through everything, weight, body mass index. You know, we really, there's no hiding in my office, unfortunately, from that. And then I do a full physical exam, and it's shocking how much sometimes you'll find what people don't know with murmurs and little things that they're like, no, I was never told that. And then I have one of my favorite tools is a small handheld echocardiogram. It's really more of an extension of my stethoscope. So I actually show my patients their heart. I show it how it's beating. I put on what we call Doppler flow, and they can see the blood flow. They look at their valves. That's not good enough to actually look at their vessels. You know, that's too small, but it gives you a very nice idea of what the heart looks like. I, of course, do an EKG. But what I tell my patients is really EKGs and echoes and exam in an otherwise healthy person are actually most helpful when they're abnormal. When they're normal, they don't actually tell you what's going on inside your heart. And so then we talk about what that next step should be, which again, if someone's having symptoms, a stress test can be very helpful just to see if we think that their chest discomfort or their pain or their jaw pain or their arm pain is caused by an obstruction in their arteries. But if people feel well, for example, I had a gentleman in not long ago whose father died at 50. He is 49. His brother already has a stent, and he runs marathons. And he feels great. He's, you know, but so stress test isn't going to tell me what his problem was. You have to have a 70% blockage or more to come up on a stress test, because think about it, it has to actually impede flow. And so what I prefer is to actually image the arteries, which is the link with the Dalio Institute of Imaging. Is so we can image the arteries in numerous ways. There's one called a calcium score and one called a CT angiogram. And the calcium score looks for calcification in the arteries, and when we say that, it's really calcified plaque. And the CT angiogram looks for both calcified and soft plaque, and then gives us a risk estimate based on that also.
Interesting. So at the Dalio Institute, you work for quite a large institution. And as I understand it, you employ a multidisciplinary approach to health. What are some of the other areas of the institution that you work closely with?
That's a great question. So heart health, which is sort of one side of it, is the clinical program. And like we just talked about, it's all about clinical care of the patient. The Dalio Institute of Cardiovascular Imaging and New York Presbyterian is really a research institute. So it is a research institute on cardiovascular imaging and devices, and so it's really looking at high-end changes in imaging. And Dr. James Min, who I work with, runs numerous clinical trials and registries on looking at CT angiography and different other modalities in assessing cardiovascular risk. And so the connection there is it's actually a brilliant thought on Dr. Min's part is that, you know, what is all of this imaging and research if it can't translate into patient care? And so it's really a nice way of actually marrying the two, and running our clinical trials is putting those two things together.
Yeah, fascinating.
So speaking of clinical trials, can we talk a little bit more about the trials and the research that you're involved in? And I know you just mentioned a couple areas, but you know, so what are some of the more topics that you guys are looking at, and can you share some of the results that you have seen?
Absolutely. So, you know, since I joined a little more than a year and a half ago, we've actually already recruited and closed up one study. It was called Decide Gold, which we're waiting on starting to get the results going. And I'll give you an example of exactly what that study was. So that was looking at patients who had symptoms suggestive of cardiovascular disease, and then were appropriate for either an angiogram or a stress test. And when we put them in the trial, they got a CT angiogram, and then they got something called CT perfusion, and something called FFR, CT FFR. And FFR is fractional flow reserve. And that's just an absolutely fascinating new part of cardiology. So fractional flow reserve is based on computational flow dynamics. And so it's a mathematical model that you can get from the CAT scan. So with absolutely no more radiation, no nothing, you take the person's scan and you send it to the company that does it, called HeartFlow, and they derive a flow through the arteries. And so we're trying to see if, once we see the anatomy, can we then determine if that blockage is actually obstructive. So it's really, that's sort of new, and that's what we're studying. So that was a study that we did. other ongoing trials. We have one that's called 4 Steps that we just finished through our IRB, our institutional review board. So you have to get everything through that first at an academic institution. And that one is looking, we're starting with women only. It's a pilot study. We thought we should just focus just on one group for now. And that's women leaving our 4th floor, which is the cardiac floor, having had a heart attack, a stent, or bypass surgery. And like an AA model, like you said, support, we have 1/3 just getting standard of care, which is appointments, get your meds, go see your doctor. The second group actually is getting set up with a mentor-mentee in like an AA kind of thing, where they're either Skype or in person or by phone, is going to actually hook up with someone who has been through the same thing and see if that can help not only with follow-up, but taking their medications, outlook, well-being, and heart endpoints, blood pressure, heart rate. Let's see what it does for them. And then the third arm of it is actually going to be formally trained in transcendental meditation to see if meditating actually also helps. So it's a much more holistic. So you see one end of it is all about the imaging, and the other end is all about the holistic approach to care.
Yeah.
So that's just 2 examples of what we're doing, and there are several others.
Yeah. So the technology has really changed, right? I mean, I think back and some of the older tests that I had, even my thallium stress test. There's new technology is coming to market, but I'm curious to know, if you kind of stratify your patients, and you look at them and we put them in 2 buckets. So those that have hereditary heart disease and are candidates or have a higher risk factor, and those that are almost kind of self-induced, right? Not exercising, eating poorly. How do we look at that? Is the majority of the population those folks that are neglecting them, their well-being and their health?
I think neglect is a harsh word. We don't try to neglect ourselves, but yes, I think in many ways, I would argue 80% of the people I see, so much of this is reversible just by exercise and diet, and so much of it can also be told to the patient. So for example, we're looking into, obviously we get a cholesterol profile and we see what that cholesterol profile is, and we look at their blood pressure, and all of these things are changeable to a certain degree. But I can also look at absorption parameters of cholesterol. So some people actually are what we call hyperabsorbers. So yes, the dietary guidelines took out some of the restriction on cholesterol in food. They took out that don't eat more than 300 milligrams per day of cholesterol. But that's actually not good advice for certain people, because some people absorb more out of their food than others. And so I can check that for you also. So I think that we can individually take people and say what's the best way for you to do it. And like you said, that 20% who come in who, they do everything right and their cholesterol is still 300 and their LDL is still 190, those people will be absolutely benefited by cholesterol lowering medications, and we work with those also.
Yeah.
So we're talking about some ways of preventing heart disease, and we mentioned some people in the beginning of the show who have certain chronic conditions, inflammatory bowel disease, other autoimmune disease, anxiety, things like that. How can these people sort of help to lower their risk as well?
That's a great question, and especially because you don't want to dump yet one more thing on someone who's already got a lot going on. And so I think our holistic approach does help. First of all, there's no judgment here. We are all working together, and I help assess sort of who's that next person that we could really help you. And most often, I actually think it might be our nutritionist who works with patients very closely. And then I also work with 2 behavioral psychologists, one of whom taught me how to do biofeedback. And again, I also refer people for meditation, and whatever kind of meditation they want to do. I do transcendental. My nurse works in a more mindful-based meditation. But people help you there also, sort of what they're willing to do. The diets that are out there, we as cardiologists, we tend to talk about the Mediterranean diet, or something called the DASH diet. I don't know if you know the DASH diet. It's the Dietary Approaches to Stop Hypertension. It was a study diet that actually lowered blood pressure, but also lowered LDL cholesterol, similar to the Mediterranean. So that tends to be one that we talk about the most because it's realistic. but there are much more militant diets that really can lower the cholesterol, you know, with very, very little fat, no oils, things like that. And that, you really have to get to know the patient to know what they're willing to do.
Yeah. You know, this month is National Minority Health Month. And I've seen numbers that suggest around heart health that minorities are at a higher risk. And some of the numbers that I've seen, although I won't quote them here, were pretty alarming to me.
Yeah.
How do we, in your opinion, begin to curtail that and reverse that trend that I'm seeing around heart health in the minority population?
You know, I think so much of it is education and getting to the young. We work very closely with Dr. Holly Anderson at New York Presbyterian also, who is the education director at the Perlman Institute, and they do a ton of outreach. So one of the things, for example, that I think is just absolutely fabulous is they work with a church-based outreach group. So it's getting to these communities and speaking to, and I hate to say it, but to the women of the group. So many of this is actually driven by the women in these communities and getting it out there. But education is one. I think working with the diabetes and the obesity epidemic in the young. I think especially in African Americans, the risk of hypertension, high blood pressure is significant, especially for kidney renal disease. So I think really focusing on what is more specific to those groups and their risk and their ethnic preferences. You know, it's going to be hard to get someone at very high risk, for example, who's Chinese, to want to eat a Mediterranean diet. They're not used to a Mediterranean diet, but let's work within what they're used to.
Right.
You know, and fish-based and not so much of the carbs, you know, they're very high in carb, but lean proteins. And we can do that without going, you know, militantly Mediterranean. And I think you really do have to work with those specific groups. That's what's so great about this country is there's so many of us, but it's harder to actually focus on risk in that sense.
You know, I think it's everybody's challenge as well, or opportunity to help. And by that I mean, you know, I see the NFL, and they have this big campaign called Play 60. And it's all about take your kids out from behind the game console, sitting there on the couch, and 60 minutes a day, get outside and exercise, right? And, you know, for good, bad, or indifferent, I mean, these children look up to athletes, and so I think it's a powerful message, that Play 60 that the NFL is bringing forward. And so, you know, everybody can play a role in this. We can't always rely on putting it over to our healthcare professionals, because let's face it, you see these patients a very small amount.
Even an hour
right.
isn't enough.
Right. Even an hour isn't enough. But if you think about it, we've got to, you know, communicate the message to these people, and myself included. I mean, all of us, right? We all need to be concerned about this at different touch points during our life. And so it's not just the medical professionals that we need to rely on. It is the NFL and the NBA and other organizations that can help out.
And I think school systems.
School systems.
To really, you know, what these kids are eating in school. And, you know, unfortunately when budgets get cut, what gets cut? Gym.
Right.
You know, the outdoor activity. And I had one of my patients maybe 10 years ago had just a great statement. He had lost over 100 pounds with Weight Watchers, you know, and he kept it off, and he was a counselor, and he said, you know, if an alien looked down on this country, they wouldn't say, oh my goodness, everyone's so fat. What they would say is, how on earth could anyone be thin? And I think of that, it's like a constant, you know, you've got to stop. You don't want to go to that machine and pick out the, you know, drink with 50 grams of sugar in it. You want, but that's what's available.
Right.
You know, and so changing that mentality of putting healthier snacks and healthy stuff out there. You know, a 10-year-old isn't going to think about that. You know, and so I do think it's education in the house, education in the schools, policy change. Boy, we could have a whole other conversation about that, but you know, I really do think it has to start much younger.
Yeah.
Well, I love that you bring up the aspect of schools, because schools play a huge role in eliminating food insecurity in young children, and then also as communities we need to try to eliminate food deserts, because people may want to eat healthy, but they can't because they don't have a nice grocery store.
I absolutely agree with you.
Well, I have just one last question for you. For our patients and family members on the website who may want to make an appointment with the Heart Health Program or the Dalio Institute, where can they go to find more information?
Well, we do have a lovely new website we put up. It's hearthealth.weillcornell.org. So for the org, but I think also if you just put in my name, that would put you to the Cornell website, and then obviously, and we tried hard to get a phone number that would work, and it's a 646 because of course I think in New York we ran out of 212 numbers, but 646-962-HART.
Oh, that's
so
cute.
Perfect.
It's a little better, you know, it's heart. It's 4278, but HART. But any of the things will either get you to the Heart Health website. And what I like about our website is more that we really try to put on there, like if you think you're at risk, we have, you know, a list of people, you know, all the things we talked about today. But in general, if you just think you're at risk and want an evaluation, I'll help you with that.
Yeah. Perfect. Well, thanks for coming in today.
It's my pleasure. Thank you for having me.
Very, very informative, and I want to invite you back. Keep us posted on the work that you're doing, and I think I'm going to come in for a checkup and a consultation, see what happens.
Love to see you.
I might even bring a video camera, and we'll record it for everybody
We'll record
at
his
home.
CAT scan, right?
Yeah, absolutely. So once
Awesome.
again, thank you for coming in. I'd like to thank our viewers this afternoon for tuning in, and I want to thank our sponsors for making this all possible. Remember, all of our episodes can be viewed on demand at healthyho360.com, and our podcast can be found in the iTunes store. Well, you guys know we're all about social media, and Courtland is going to share our efforts with you.
We're all over Facebook, Instagram, Twitter, and Pinterest using that hashtag #RealStories when posting, and we'd greatly appreciate it if you would do the same. On behalf of Dave Duplay, myself, and the entire HealthyO360 family, we'd like to thank you again for joining us today, and we look forward to seeing you again next week when we're chatting with Dr. Rosenbaum about his very innovative diabetes-safe chocolate.